Today we are going to discuss about acid etching. Acid etching is the first step for any bonded restoration. If you want to bond a restoration or bond a processes to a tooth structure, the first step after the cavity preparation or the tooth preparation that we do is called acid etching. Acid etching was first described by an author called Michael Buonacore. He demonstrated acid etching by using 85% phosphoric acid for 2 minutes. Later on, an author or a researcher called Silverstone reduced the concentration of acid. He also reduced the time period. The current strategy for acid etching is utilizing 37% phosphoric acid for 15 to 20 seconds. I repeat, the current strategy for acid etching is utilizing 37% phosphoric acid for 15 to 20 seconds. Now let us see what all happens on the surface of an enamel when you apply and wash off an acid. Normally, the surface of the enamel is covered with a layer known as pellicle, and such a pellicle covered enamel layer will be having extremely low surface energy. So, when you acid etch a enamel, this layer pellicle is removed by the acid and it exposes the underlying surface of the enamel with high surface energy. Now let us summarize the effect of acid etching on enamel. First and foremost, it completely removes the smear layer. About 10 micrometer of the surface enamel is removed by acid etching, and thus the ends of the enamel rods get selectively dissolved. Acid etching will also create porosities with diameter 5 to 50 micrometers, and these areas will be having very high surface energy. With the creation of microporosities, there is also a notable increase in the surface area of enamel, almost 2000 times. To summarize, acid etching will transform a smooth enamel surface into an irregular surface having very high free surface energy, which is almost twice that of a unetched enamel. After acid etching, the next step is application of bonding agent. Bonding agents are basically unfilled resins. So when a fluid unfilled resin is applied to an etched surface, the resin will penetrate into the surface with the help of capillary action. And we know resins are basically monomers. So the monomer in the material will polymerize and the polymer will become interlocked with the enamel surface, resulting in formation of what we call as resin tag. Now the resin tags are basically of two types, micro tags and macro tags. The resin tags that form between the enamel rod peripheries are called macro tags, and the resin tags that form at the ends of enamel rod are called micro tags. Micro tags are a much finer network. They form across the end of each rod where the hydroxyapatite crystals have been dissolved. And it is the micro tags which contribute to the maximum bond strength because of its greater quantity and larger surface area. So let us summarize how an acid etching is done. Acid etching is done with the help of 37% phosphoric acid for 15 to 20 seconds. This will create a clean enamel surface with microporosities contributing to its high surface energy. On top of an acid etched tooth surface, we will apply a low viscosity resin which will infiltrate into these microporosities through capillary action. And these resins will polymerize to form what you call as resin tag. And these resin tags are interlocked in the rough enamel surface. The resin tags that are formed between the enamel rods are called macro tags, and the resin tags that are formed at the end of each enamel rod after dissolution of hydroxyapatite crystals are referred to as micro tags. In this picture, you can very well appreciate the macro and the micro tags between the enamel rods. Two scientists called Gwinnett and Silverstone has actually found out that etching onto the enamel surface will create peculiar patterns when viewed under microscope. And they basically described three patterns. Type 1 is called an honeycomb like appearance, type 2 is called cobblestone like appearance, and type 3 is a mixed pattern. What happens in type 1 is that there is selective removal of enamel prism cores, but the prism peripheries will be intact, thus giving us the appearance of a honeycomb. In type 2, what happens is that there is selective removal of the enamel prism peripheries, whereas the prism core will be intact, thus giving a cobblestone appearance. And type 3 is a less distinctive type of etching pattern, resembling both type 1 and type 2 patterns. So, what are the steps in enamel bonding? First, we have to do an oral prophylaxis, which includes a thorough cleaning and polishing of the tooth surface. Then, we will apply 37% phosphoric acid for 15 to 20 seconds. We will rinse off the acid in about 5 to 10 seconds by rinsing for 5 to 10 seconds, which will be followed by drying the tooth surface, which will give us a frosty white appearance. And after this, we will apply the bonding agent. So by enamel or tooth prophylaxis, we will be removing the slurry, removing the pellicle. We will get a clean surface on top of which we will be able to apply the acid etchant. Acid etchant can be in different forms. The current strategy, as I have mentioned before, is utilizing 37% phosphoric acid for 15 to 20 seconds. If you increase the concentration of phosphoric acid by more than 50%, it will result in formation of what you call as monocalcium phosphate monohydrate, which will prevent further dissolution of resins. And if you use a concentration less than 27%, it will result in formation of dicalcium phosphate dihydrate, which not be able to easily remove. The acid etchant is also available in different forms. It can either be in liquid form, where we will use a micro brush or cotton pellet to apply onto the tooth surface. Most commonly available form of acid etchant is in the form of a gel, and by utilizing a gel, we will be able to localize it to a specific area, and by using different colors, we will be able to easily identify or differentiate it from the tooth surface. And as I've mentioned before, the standard etching time is 15 to 20 seconds. For newly erupted adult permanent teeth, it actually requires lesser etching time. But in a teeth with enamel fluorosis, or in case of a primary tooth, we need to increase the etching time by 60 to 120 seconds. This is followed by rinsing with a continuous stream of water for 5 to 10 seconds, followed by drying with a clean dry air, which will give us a frosty white appearance. Important thing to note is the fact that if at all an etched enamel is contaminated by saliva, blood, or any kind of moisture, it will prevent further bonding and all the etching steps have to be repeated. In this picture, you can very well appreciate the frosty white appearance which is seen after etching the tooth surface. And finally, onto a etched surface, we will be applying a bonding agent which can be BIS GMA, UDMA or TEC DMA, and these hydrophobic resin will easily penetrate into the microporous enamel with high surface energy, resulting in formation of resin tags which will lock this resin into the enamel surface, thereby creating a micromechanical bonding of 15 to 25 megapascals. Thank you.